Is there a medication for weight loss? Yes. What you see in my hand here? It's a weight loss injection. Hello, I'm Dr. Habibi, cardiologist. As you know, being overweight and obesity can cause various diseases and, most importantly, cardiovascular complications. This was a question that many of our patients always asked us. Is there a medication or injection that we can use to lose weight and get slimmer? And our answer until that time was no. And many of the medications and pills available on the market had negative side effects. And because they were illegal and unauthorized, they would cause high blood pressure and increase the risk of cardiovascular strokes. Unfortunately, we had to hospitalize many of these patients for this very reason. But the good news is that finally, a medication was developed that does not have cardiac side effects. And that drug is called Tirzepatide, which is available in the Iranian market under the names Spartina or Mounjaro, and it truly leads to weight loss. In other words, those who complete the full course of this medication, which is 5 months, will experience a weight loss of between 5 to 20 kilograms. Of course, this varies from person to person and also depends on various other factors. This injection leads to weight loss through 3 main mechanisms. First, it reduces appetite. Because it affects the hypothalamus, it reduces appetite, causing the person to eat less. Second, it causes gastroparesis, or in other words, it prolongs gastric emptying. That is, the time it takes for food to leave the stomach increases. As a result, the stomach always feels full, the person feels satiated and does not seek out food. And finally, it improves insulin function and lowers blood sugar. That is why it is also used in diabetic patients to lower blood sugar. Well, now you might ask, who can use this injection for weight loss? Those who are overweight, meaning either have a BMI over 30 or a BMI over 27, along with high blood sugar, high cholesterol, high blood pressure, cardiovascular problems, or fatty liver. What is BMI? BMI, or body mass index, is a measure of body mass. In other words, this index is a specific number for each person, and its formula is weight in kilograms divided by height squared. The body mass index, or BMI, in a normal person should be between 20 and 25. That means if it's less than 20, we say that person is underweight, and if it's above 25, we say they are overweight. This injection comes in doses of 2.5, 5, and 10 milligrams, which are administered once a week subcutaneously. In other words, the person themselves can inject it by pressing the button on the syringe. Now, you might ask whether this medication has any side effects. Yes. Its side effects are mostly gastrointestinal, including nausea, vomiting, and diarrhea. Of course, in a very small percentage of patients, it can also lead to inflammation of the pancreas or pancreatitis. So who should avoid using this medication? First, those who are under 18 years old, and second, those with a history of thyroid cancer. This medication is not recommended for these 2 groups of people. And the final point is that this medication must be prescribed under the supervision of a specialist doctor, and you should avoid taking it on your own. Thank you.